Hello and welcome to Revising Medicine. Today I'll be discussing the symptoms of Crohn's disease. When it comes to Crohn's disease, symptoms can differ depending on the severity and where the disease is in the bowel. Your symptoms can also change and vary at any time. Severity can be mild to very weakening. The disease can occur anywhere in the GI tract, from the mouth to the anus, but it most commonly affects the colon and the ileum, which is the last part of the small intestine. I have labelled the colon and the ileum for you on this diagram using two red arrows. The main symptoms of Crohn's disease are diarrhea, cramps, tenderness or feeling of mass in the abdomen, fever, fatigue, weight loss, lack of appetite, and or blood in stool. But as I previously said, this can differ for each person who suffers from this. As the disease progresses, you could end up developing a perianal fistula, ulcers anywhere in the GI tract, skin and or joint inflammation, anemia, and or frequent bowel movement. What would you do in this situation? The best thing to do is to see a doctor, since the symptoms are very similar to other illnesses such as food poisoning. This is why you should see a doctor as soon as possible, so you can avoid having to suffer the worst symptoms later on. Now, on to diagnosis. This is the most important part, as these are the methods you will learn to use on a patient once you're a doctor. Blood tests, stool tests, endoscopies, colonoscopies, imaging tests, and tissue samples or biopsies. Blood tests give certain indicators of potential problems. For example, a symptom of Crohn's disease is anemia, which is a lack of iron in the blood, so blood tests would help us to see if the patient was anemic. A stool test allows the doctor to check for blood in the GI tract, which is another symptom. An endoscopy gets a better image of the inside of your upper GI tract, and a colonoscopy allows the doctor to examine the large bowel. Imaging tests give more detail of your tissues and organs than X-rays do. Lastly, a biopsy is taken if necessary during an endoscopy or a colonoscopy, so the doctor can examine your intestinal tract tissue to check how affected it is. These tests may be done several times to check the progression of the disease. Thank you for watching. This was a brief look into Crohn's disease. Remember, the intention of this video is only to assist you in your studies and not to give out actual medical advice. If you found this video helpful, please give me a like and subscribe, or share it with someone who you think would be interested. Leave a comment down below if there's anything else you'd be interested in learning about. See you next time!